thank you very much for giving such a nice presentations. Thanks to all participants. I would like to ask a few questions if it's possible. What is the gold standard of diagnosing the surgical site infection? How should we put the samples? What do you think? These swabs are enough, or we should take the biopsies, aspiration of the exudate, whatever you recommend for the participants at this audience?
Myself?
Yeah, probably you can start there.
If we talk about the traditional or classical perspective, I think that swabs are the worst technique to use to take samples, because swabs only take the superficial species. Likely biopsy is the best option, or the gold standard, but it has some difficulties, because this is painful for the patients and it's costly. So in the intermediate possibilities, the punction aspiration technique, in my opinion.
Okay.
I think that perhaps a wound that doesn't work well, that is maintained open over several days, and especially if this wound has exudate and doesn't behave like a normal wound. Perhaps we wouldn't expect a high amount of symptoms. Frequently, patients don't have fever, and perhaps only smaller aspects about that the wound doesn't close. So it is very different to other infections that frequently you have fever, have a very clear clinical situation that says that this patient has an infection.
Okay, thank you. Another question is about the biofilms. Are there any data about involvement, participation of fungi and viruses in those biofilms?
Yeah.
Can you comment that, please?
Yeah. There are some articles published on the role of fungi, especially. I don't know in viruses, I don't find in my literature research, but yes, on fungi. And the same authors that I mentioned, like Walcott, Steve Dodd, and so on, performing research based on molecular diagnosis, found some species of fungus, normally candidas and other species like this.
Okay, thank you.
The problem with biofilms is that, as has been commented previously, you don't see this structure. You think that this structure exists because, for example, in joint prosthesis infection, it's very clear that if you don't remove the prosthesis, the infection is going to go on. And it's a good question, what can we do to improve, to clean this structure that obviously is going to maintain the infection. So I think that we have a lot of work above us, and it's very important to have real weapon against this biofilm.
Okay. Thank you very much. Once again, thanks to speakers, thanks to participants. We are looking forward to meet you at the closing ceremony, which starts at 10 minutes past 3 o'clock in the room number 105 and 106. And those who are not attending that, you are very welcome to visit our next conference, which will take place in London, right? See you next time. Muchas gracias.
See you.
Okay, thank you.